Talks on Psychoanalysis shares topics published in the IPA Society journals and Congress debates worldwide, brought to you in the voices of the original authors. We hope this window will allow you to experience the depth and breadth of psychoanalytic thought around the world. This podcast has been created by Gaetano Pellegrini and edited by Gaetano Pellegrini and Andy Cohen. Introduction read by Andy Cohen. In this episode, Carlos D. Nemirovsky presents an excerpt from his latest book, Winnicott and Kohut on Intersubjectivity and Complex Disorders, New Perspectives for Psychoanalysis, Psychotherapy and Psychiatry. This book suggests that we need conceptualizations that encompass new clinical phenomena observed in present-day patients, considering that the traditional definitions of basic psychoanalytic notions are no longer comprehensive enough due to the complexity of scientific developments within and beyond the psychoanalytic field. From this perspective, clinical practice with complex patients can particularly benefit from Winnicott and Kohut's ideas, for these authors see each patient as unique and are in direct contact with empirical facts. Carlos D. Nemirovsky is a training analyst, supervisor, and president of the Buenos Aires Psychoanalytic Association. He is professor of psychoanalysis at the Institute of Mental Health, full member of the IPA and member of the International Association for Relational Psychoanalysis and Psychotherapy. He is author of numerous articles and books and has published in the Abdeba Journal Psychoanalysis and online, details of which can be found in the description.
Since the death of the founder of psychoanalysis, our discipline has undergone considerable changes that have largely been the product of the cultural transformation of analysts and analysts. Slowly, our way of thinking and of operating in the session have changed. Similarly, Winnicott started, and here I quote, "It would be pleasant if we were to be able to take for analysis only those patients whose mothers at the very start and also in the first months had been able to provide good enough condition. But this era of psychoanalysis is steadily drawing to a close." In the book, I first developed subjects such as early psychic development in the work of Winnicott and Kohut. Both are contemporary psychoanalysts whose perspective form part of the foundation of psychoanalysis today. What I propose is that there are similarities and differences between their approaches and the concept of healthiness, of conflict, trauma, and narcissistic disorders that they form from these perspectives. I then go on to develop a description of the characteristics of relational and intersubjectivity psychoanalysis, and especially the concept of addition, that is the new in the relationship between the patient and the analyst. Furthermore, I consider the characteristics of contemporary psychiatry. Authors with different views on psychoanalysis, clinical practice, have formulated an array of hypotheses about the development of the psyche. Each author and each school advanced their own model to understand and explain the early phenomena of psyche life that will influence adult mental organization. Original psychoanalytic theories, those that offer new ways of understanding by way of original paradigmatic ideas, prioritize specific elements to which they grant a central role in the construction of the psyche. I try to develop in the book tools to understand the formation of the adult psyche structure from the point of view not only of Winnicott and Kohut, but also of several authors with whom I have engaged in a dialogue for over 2 decades. They are Ferenczi, Ferben, Bowlby, Mahler, Mitchell, and other authors who wrote on relational and intersubjectivity psychoanalysis. Today, psychoanalysis is reworking many of the initial points of his founder. The pathologies that we tackle in our everyday practice appear farther and farther from the neurotic model, were born out of misunderstanding and separations, and we are fed by absences. Today's pathologies undermine the importance of the hysteria of the last century and ask of us a wider ranging metapsychologic as well as new explanation concerning its origins and development. I focus on the complexity of the notion of self and narcissism, and on relational and intersubjectivity psychoanalysis. I center my discussion on the relevance of the environment in the constitution of the human psyche, and obviously on the understanding of so-called psychic normalcy and pathology, in particular those pathologies that are usually designed as severe mental disorders. When tackling these complex problems, I try to provide the broadest and most detailed theoretical clinical references on Winnicott and Kohut productions. In my work, it is one of my aims to call into question orthodox approaches to psychoanalytical practice, trying to promote dialogue on a broad array of transcendent matters from the point of view of my own conceptual framework and unorthodox clinical practice. I just like to give next my overall vision of how I see psychoanalysis. Psychoanalysis is an ideal of knowledge and has therapeutic ends. It implies an asymmetric way of relating to a patient in an attempt to achieve an intimacy that makes new experience, possibly using the Socratic method. In the encounter, the patient and analyst may build together a narrative of transferential and fictional reality, which in a way creates characters. All of this requires commitment, authenticity, and spontaneity in order to develop. Building a relationship with the patient is the basis on which the communication, such as interpretation, takes place between the parts. The corporal and the preverbal are included in this idea of relationship. The two participants help to build the frame. This is usually done in a gradual manner and is always cut to size, and moreover, it should guarantee an ethical frame so that the repetition of transference and the addition of new, authentic, and spontaneous experiences has space to develop. This is an attempt at an intimate approach with the patient that is being emotionally in tune with them, so that the two of us together, in spite of our resistances, can question the patient's narrative in the dialogue that take place between us. We have added others which help us to describe good practice: curiosity, commitment, authenticity, spontaneity, hope, confidence. Perhaps it was part of all of this that Winnicott wanted to express when he noted that the process would go well if the analyst behaves. The book also attempts to analyze the characteristic of our present-day task, and thus so taking into account the following points. What do we analysts have in common? It is possible to psychopathology characteristics our patient with the model that we currently have at our disposal, or must we resort to denominating them as a generic manner, as complex patient, critical patient, and those with whom there is a difficulty to connect? What tools do we have at our disposal for use during a session? How can we transmit to our colleagues the reality of our practice? Throughout his life, Freud referred on many occasions that what he considers psychoanalysis to be. This concept changed as he got older and gained more clinical experience, as we would expect with a nonconformist who is sensitive to change. However, the concept also changed according to the political dimension of psychoanalytical movement, as well as being influenced by the contextual changes which took place in Vienna in the interwar period. For this reason, not all of the definitions were similar, given the time that passed between them. Gradually, the psychoanalysis that Freud was developing was gaining in complexity. As with Freud, we analysts often discuss what is exactly that we do in our consulting rooms, how we work trying to find out what is that we do, what is change and what is cures. That is to say, we are continually posing the questions as to what is constant in psychoanalysis. Personally, I have become used to conceptualization, the task to be carried out with my patient, but I try to put words to that I observe. I come across the stumbling block that most of our works is ineffable. That said, I will now attempt to give a summary of what I think to be central in the task of the analyst. Relational and intersubjectivity approach views psychoanalytic treatment as the co-creation by patient analysts of a safe environment that, based on a continuous meeting, will facilitate an intense, deep joint exploration of unconscious aspects and make possible the addition of unlived or novel situations. Co-creations depend on the analyst-patient relationship and its context. It is not universal and transcends the traditional debate on via del porre by via del levare by advancing a third option, the via di creare, which include both members of the analytic couple. via the Creare being created by Robert Erzner, as told me in a personal communication. This approach was already germinating in some of Freudian writings, especially in inhibition symptoms and anxiety, and was developed in different ways by the Hungarian school, Ferenczi and Bálint, by members of the British school, including Fairbairn, Bowlby, Winnicott, Bolas, by North American thinkers such as Kohut, Guido Goldberg, Moder, Ogden, Stollerow, Atwood, Mitchell, and Orange, as well as by independent theoreticians with different origins and training, for example, McDougall, Killingmore, Bernstein, Puget, and Bleichmann. We should probably also add Pichon-Rivière, Blecher, and Baranger, who made major contributions to intersubjectivity perspective. From this perspective, and following the ideas of Riera, we could think of Oedipus as an abandoned child and not a parricidal Oedipus, and Narcissus as a teenager who needs a gaze that will integrate himself and rescue him from disintegration. These new provocative ways of thinking about the psyche are the product of social phenomena that participate in the current construction of subjectivity. Contemporary life, perplexity, indeterminacy, and uncertainty have given rise to new paradigms that in turn have shaped diverse approach to and ways and conceptualization psychoanalysis. Intersubjectivity means envisioning subjects who are open to their history, their present, and their future, who live in the paradox inherent in the repetition versus newness equation. Subjectivity is constituted in a process of becoming. It is not only repetition or re-edition, it is edition as well. It is not just representation, but also presentation. It is not mere release and search for equilibrium. It is also a search for object and complexity. Intersubjectivities consider that subjects are open to their culture, are marked by events.